Welcome to the Deep Dive. Today we're tackling a topic that seems really important to many of you, endometriosis.
Mm,
You've asked about exploring complementary ways to manage it, maybe improve fertility, and that's exactly what we're going to do.
yeah, our goal today is really to give you a clear picture, drawing from some really detailed sources you shared, but without making it feel overwhelming.
Right, so the material we have really frames endometriosis as a condition where tissue that's like the uterine lining grows outside the uterus itself.
Exactly. And the key thing is how this tissue then reacts to your normal hormonal changes each month. That reaction often triggers inflammation, pain, and yeah, sometimes real challenges with fertility.
And while there are conventional treatments,
hmm
it makes sense that people look for, additional support, other angles.
Absolutely. And your sources, they really zero in on acupuncture and herbal medicine, particularly using the lens of traditional Chinese medicine or TCM.
Yes. As potential partners, let's say, in managing things. So we'll explore how these might help with inflammation, maybe ease symptoms, and even support fertility.
And we'll also look at the work of someone mentioned prominently in the materials, Mike Berkeley, an acupuncturist in New York City who seems to be a real pioneer in this.
Sounds good. Okay, let's get into it. Based on the texts we have, what's actually going on in the body with endometriosis?
Well, consistently, the sources describe it as tissue resembling the uterine lining, showing up in places it shouldn't be outside the uterus.
Okay, seems straightforward enough.
But it kicks off a whole cascade of issues. The big ones highlighted are significant inflammation, often chronic, quite debilitating pain, and then, yes, considerable hurdles for conception.
And the hormones connection.
Right. The sources really underscore how your natural hormone cycles play a huge role in sort of fueling the condition and its symptoms. So misplaced tissue reacting to hormones causing inflammation and pain. That's the core issue.
That hormonal link does seem absolutely central. Okay, let's pivot to acupuncture then. How do our sources say this ancient practice might help with endo-infertility?
Well, the core idea behind acupuncture, as the texts explain it, is stimulating the body's vital energy flow to restore balance.
That's balancing the system.
Exactly. And looking at endometriosis through that TCM framework, acupuncture often targets what's called stagnation. Think of it like a traffic jam for blood and energy, especially in the pelvic area.
Okay, blockages.
Precisely. And that stagnation is seen as being really closely linked to the inflammation and pain that are such hallmarks of endometriosis. Acupuncture aims to get things moving smoothly again.
So encouraging better flow, kind of clearing out that congestion.
You got it. And the research discussed in our materials suggests acupuncture might actually influence the body's inflammatory response. It seems to have an effect on key hormones like estrogen and progesterone.
Interesting.
Plus, by improving blood circulation to the pelvic region, it can help ease that inflammatory environment, the kind of environment that makes it tougher for an embryo to implant and for pregnancy to stick.
Better blood flow means, well, it sounds like healthier tissue, less inflammation, almost intuitive.
It does feel that way, doesn't it? And the sources get pretty specific about how it might do this.
Oh, yeah. What do they say?
They detail how acupuncture seems to lower the levels of these things called pro-inflammatory cytokines. Think of them as like little messenger molecules telling your body more inflammation.
Okay, turn those down.
Right. And at the same time, it appears to enhance the body's own anti-inflammatory pathway. So it's a kind of dual action.
Boosting the body's own calming mechanism.
Exactly. Which is significant not just for potentially easing that chronic pelvic pain, but also for creating a more receptive uterine environment for a possible pregnancy.
Okay, that makes sense. And what about for people going through fertility treatments, like IVF? Do the sources mention a role for acupuncture there?
Yes, they do. The research highlighted suggests it might positively impact clinical pregnancy rates for women using assisted methods like IVF.
How so?
Well, it's thought to be partly because it can optimize what's called endometrial receptivity, basically making the uterine lining as welcoming as possible for an embryo.
Making it sticky, so to speak.
Kind of, yeah. And another factor mentioned is stress reduction. Acupuncture can help lower stress, and we know high stress isn't great for inflammation or fertility outcomes. So it's about creating the best possible conditions.
Okay, that gives us a really good handle on the acupuncture side. Now let's shift gears slightly to herbal medicine. How does that fit into the picture, according to our sources?
Herbal medicine is presented as working very closely with acupuncture. While acupuncture might offer more immediate effects, like on blood flow, the herbs are seen as addressing deeper systemic imbalances.
So more foundational work.
Yes. The herbal formulas are typically customized for the individual based on TCM principles. For endo, a key TCM concept is blood stasis, which relates to that tissue buildup and inflammation we talked about.
Right, the stagnation idea again.
Exactly. And the herbal remedies aim specifically to help break up that stasis. It's a more internal, maybe longer-term strategy to address those root causes.
So working from the inside out, tackling the underlying issues.
Precisely. The herbal blends described are designed to work synergistically, improving circulation, reducing pelvic congestion, supporting hormonal balance, all really crucial for minimizing inflammation and supporting fertility.
And there's evidence mentioned.
Yes, the clinical evidence cited points towards potential reductions in endo-related pain and also improved pregnancy outcomes. It's about rebalancing the system.
And it sounds like it's not just symptom management. Our materials suggest it might go deeper.
That's a really key point. The texts explain that herbal medicine can target some of the fundamental drivers, like excess estrogen, maybe, or poor circulation. By tackling those, the idea is that herbs might help shrink lesions and maybe even prevent recurrence.
Wow, so potentially modifying the condition itself over time.
That seems to be the potential suggested. Getting to the root rather than just covering up symptoms. It's a different angle.
And what about conception rates? Do the sources mention specific benefits there?
They do. They highlight potentially increased conception rates when herbs are used alongside conventional treatments or RT, especially, it seems, for women with a history of implantation failures or miscarriages linked to endo.
So like an extra layer of support in those really tough cases.
That's how it's presented, yes. A powerful combined effect seems possible.
Okay, now let's bring Mike Berkeley back into the conversation. Our sources definitely position him as a key figure. What makes his work stand out?
Well, what's really notable is his long history. He's been focused on fertility in NYC for over 20 years. And the texts emphasize he was actually the first U.S. acupuncturist to specialize exclusively in fertility.
Wow, okay. So a real specialist from the get-go.
Yes. His clinic, the Berkeley Center for Reproductive Wellness, is presented as this hub for integrative care. He's been dedicated to this field for a long time.
And his approach? Is it just acupuncture and herbs?
It's described as very integrative. So yes, acupuncture and herbs are central, but he also incorporates other things like low-level light therapy, apparently.
Interesting.
And his expertise seems to stem from understanding both TCM and Western reproductive endocrinology. That blend allows for really personalized plans focused on tackling inflammation and other fertility hurdles.
So bridging the Eastern and Western perspectives?
Exactly, bringing the best of both worlds together for each patient.
And has it worked? I mean, what do the sources say about results?
They definitely highlight a strong track record, helping hundreds of couples, including those with complex situations involving endometriosis, where maybe conventional methods alone weren't enough.
That's encouraging.
And his patients, according to the texts, praise not just his empathy, but the results of successful pregnancies. His work seems to have really helped elevate the role of these therapies in fertility care overall.
That's great to hear about that kind of impact. Okay, let's tie things back together, this synergy between acupuncture and herbs. Our sources stress this combination. Why are they seen as so effective together?
Well, looking at the big picture, using both offers this really holistic kind of multi-pronged strategy. Acupuncture can give more immediate benefits, improving blood flow, calming inflammation fairly quickly.
Right, that faster acting component.
While the herbal medicine provides that deeper, more sustained support, addressing the underlying systemic stuff that contributes to endo over the longer term.
So they complement each other, short-term relief and long-term balancing.
Perfectly put. They work hand in hand, tackling the problem from different angles, different timelines.
And the goal is better uterine health overall.
Yes, collectively they aim to optimize uterine health, potentially improve egg quality, and just generally increase the chances of a successful pregnancy.
Does it mention IVF integration again here?
It does. The sources mention the potential for enhancing IVF outcomes when these therapies are integrated, particularly around the crucial time of embryo transfer both before and after.
Creating the best possible window for implantation.
That's the idea, supporting that critical phase.
And a key point seems to be that this approach works with the body.
Yes, that's emphasized. It supports the body's natural processes, which might mean fewer side effects compared to some pharmaceuticals.
That's definitely appealing.
And the texts also mention these other benefits: reduced pain, better emotional well-being, just a renewed sense of hope, which Mike Berkeley apparently sees a lot in his practice. It's a gentler way to support healing and fertility, potentially.
Okay, so if we were to boil it all down, What are the main takeaways from this deep dive into our sources on endo, acupuncture, and herbal medicine?
I think the central message is that acupuncture and herbal medicine, rooted in TCM and really exemplified by someone like Mike Berkeley, offer genuinely promising complementary options.
Complementary being the key word.
Yes, for managing endometriosis-related inflammation and potentially improving fertility. They do this by tackling both the immediate symptoms and those deeper underlying imbalances. It's a holistic perspective.
And it's crucial to remember, as the sources suggest, these often work best alongside, not necessarily instead of, conventional medical care, an integrated path.
Absolutely. That combination seems to be where the real strength lies for many people, according to the materials we looked at.
So for you listening, as you think about endometriosis and your own health journey, maybe the final thought is this. What could integrating holistic approaches like TCM alongside your conventional medical care look like for you? Perhaps digging a bit deeper into TCM principles or learning more about acupuncture or herbal medicine specifically could offer some valuable new perspectives or support on your path to well-being and reproductive health.